Exercise is medicine for brain as much as body, perhaps more. Effects on mental health are profound, measurable, often superior to medication. This is evidence. This is neuroscience. Depression responds powerfully to exercise. Meta-analyses show exercise as effective as antidepressants for mild to moderate depression, sometimes more effective without side effects. This is remarkable. Mechanism is multiple, not single. Pathway. Exercise increases BDNF, brain-derived neurotrophic factor. This is Miracle-Gro for brain. Promotes neuron growth survival, particularly in hippocampus. Hippocampus shrinks with depression. BDNF from exercise helps it regrow. This is structural reversal of depression-related. Brain changes, medication doesn't do this. Exercise does. Neurotransmitters increase with exercise. Serotonin, dopamine, norepinephrine, all the ones antidepressants target, but exercise increases them naturally through multiple pathways, more sustainable than medication. Endorphins are released during exercise. These are natural opioids, create runners, high, reduce pain, improve mood. This is why exercise feels good after, even if hard during. Endocannabinoids also release during exercise, similar to cannabis compounds, create calm, euphoria, reduce anxiety. This is another mechanism for exercise. Mental benefits, natural, legal, healthy. Inflammation decreases with regular exercise. Chronic inflammation is linked to depression. Exercise is anti-inflammatory, reduces inflammatory cytokines. This may be major mechanism for antidepressant effect. Anxiety reduces with exercise, both acutely and chronically. Single session reduces anxiety for hours. Regular exercise reduces baseline anxiety over weeks. This is anxiolytic effect without medication. The mechanism for anxiety reduction involves exposure to physiological arousal, heart racing, breathing hard, sweating, unsafe. Context, brain learns. These sensations aren't dangerous. This reduces panic sensitivity. Stress resilience improves with exercise. HPA axis becomes less. Reactive returns to baseline faster after stress. This is biological. Stress management through physical training. Self-esteem increases with exercise. Achievement, mastery, physical capability all contribute. Body image improves even without. Weight loss, feeling strong, capable, matters. For mental health, sleep improves with exercise. Fall asleep faster, sleep deeper, wake less. During night, sleep quality affects mental health profoundly. Exercise improves both. Virtuous cycle. Social connection often comes with exercise. Group classes, running clubs, sports teams, social isolation is major risk factor for depression. Exercise provides structure for connection. Cognitive function improves with exercise. Memory, attention, processing speed. Executive function all benefit. This is immediate and long-term. Exercise is cognitive enhancer for all ages. Neurogenesis happens with exercise. New neurons grow in hippocampus throughout life. Exercise is most powerful. Known stimulus for this. This is brain regeneration from movement. Type of exercise matters somewhat. Aerobic exercise, running, cycling, swimming has most. Research for mental health benefits, but resistance training also effective. Yoga, Tai Chi also beneficial. Intensity matters too. Moderate intensity is sufficient. Don't need high intensity for mental health benefits. Brisk walking works. Light jogging works. Consistency matters more than intensity. Duration recommendations vary. 30 minutes most days is standard, but even 10 minutes helps. Some exercise is better than none. For mental health, start small, build up. Outdoor exercise may be more beneficial than indoor. Nature exposure adds benefits. Sunlight, fresh air, green space all enhance mental health. Effects of exercise. Combine when possible. Timing matters for some. Morning exercise sets positive tone for day, reduces cortisol, improves alertness. Evening exercise can help. Some people sleep but may interfere for others. Individual variation. Barriers to exercise are real. Depression itself reduces motivation, energy, makes starting very hard. This is cruel paradox. Treatment requires energy that depression steals. Start tiny, build gradually. The evidence is overwhelming. Exercise should be first line treatment for depression, anxiety, not just adjunct, not just lifestyle advice, actual medicine with mechanisms as strong as drugs. Doctors should prescribe exercise specifically with dose, duration, frequency like medication. Exercise is prescription that works for mental health, physical health, longevity, all together. The challenge is adherence. Medication is passive. Swallow pill. Exercise requires active participation, ongoing effort. This is why support matters. Accountability, social component. Make adherence easier. Exercise is not cure-all. Severe depression needs medication, therapy, too, but exercise should be part of treatment, always. Evidence supports this strongly, consistently, convincingly. Your body moving changes your mind. This is biology. This is neuroscience. This is hope for millions suffering mental illness. Movement is medicine. Use it.